Status epilepticus, a medical emergency, is seizure activity that does not stop. It can cause unconsciousness and jerking activity of the body. Doctors are planning to conduct research at the University of Maryland Medical Center to determine the best way to treat seizures that have not stopped after a full dose of medicine has been given. Epilepsy is the most common cause of status epilepticus. Other causes include traumatic brain injury, a brain tumor, stroke, alcohol, illicit drug use, and high fever in children. Status epilepticus is dangerous. It can cause brain damage, low oxygen, nerve injury, tissue damage, and death. As many as 17% of patients with status epilepticus may die. The longer a seizure continues, the higher chance the patient will die. To treat status epilepticus, patients are given a benzodiazepine like Valium. Seizures that do not stop after the first dose of treatment is given are known as established status epilepticus, or ESE. Many different drugs may be used to treat ESE. Some of these include fosphenytoin, valproic acid, and levetiracetam. Sometimes the patient must be completely sedated using a drug like propofol or phenobarbital to stop the seizure. This may cause the patient to stop breathing and require life support. Sometimes 2 or more drugs may be needed to stop the seizure. It is not known which drug is best for stopping ESE. The established status epilepticus treatment trial, or ESETT, is designed to determine which of 3 commonly used drugs works best to stop ESE. Any patient who is 18 years or older with active, recurrent, or ongoing seizure activity lasting longer than 5 minutes, who has already received an adequate dose of benzodiazepine in the last 5 to 30 minutes, will be included in the study. Any patient less than 18 years of age, patients with low or high blood sugar, women known to be pregnant, and prisoners or anyone known to be in police custody will not be included in the study. Patients who have requested an opt-out bracelet or are wearing a medical alert tag that says ESETT declined will not be included in the study. Every eligible patient who comes to the emergency department at the University of Maryland Medical Center will be considered for the study. Every patient in the study will be treated with a medication for their seizure. A single dose of one of the 3 drugs being studied will be administered through an IV. The study drugs are fosphenytoin, levetiracetam, and valproic acid. 1/3 of patients will randomly get fosphenytoin, 1/3 levetiracetam, and 1/3 valproic acid. As the study progresses, a higher proportion of patients will be randomized to get the drug that is doing better. During the study, a blood sample may be taken to test for the study drug in the patient's bloodstream. If the patient's seizure does not stop after the study drug is administered, doctors will follow normal procedures to stop the seizure. This may include administering another drug. This could be one of the study drugs or a different medicine. All patients will be monitored by the study team while in the hospital. All 3 study drugs are commonly used to treat seizures, but which is best is not known. The risks of these drugs are the same whether they are given in this study or for treatment of seizures outside of this study. Risks and possible side effects include drowsiness, dizziness, or an allergic reaction. In addition, fosphenytoin may cause low blood pressure, slow heart rate, inflammation of the blood vessels, or skin rash. Levetiracetam may cause behavior changes such as nervousness, confusion, or aggression. Valproic acid may cause skin rash or liver or pancreas problems. Pain, bruising, swelling, redness, or infection at the IV site may also occur. There may be other risks that we are unaware of. Because we do not know which of the study drugs is best, study participants may benefit from receiving a better medicine, but this is not guaranteed. The information that we obtain from this study may help patients in the future. This study is different from other studies. In other studies, an investigator explains the study and its risks and benefits. The patient is able to ask questions and can decide whether to participate or not. This process is called informed consent. In this study, patients are unconscious and therefore cannot give permission to participate. The study drug also has to be given quickly, so there is not time to explain the study to family and ask for their consent. We conduct emergency research under very specific federal regulations called Exception from Informed Consent, or EFIC. EFIC allows research to begin without informed consent. These rules were developed by the federal government and are closely supervised by local research boards. EFIC can only be used when a patient's life is at risk, the best treatment is not known, the study might help, and it is not possible to get permission from the patient because of his or her medical condition, or from the patient's family because the medical condition needs to be treated very quickly. To conduct an EFIC study, we must provide community consultation and public disclosure. This means that we must discuss the study with community members and gather their opinions in advance. During the study, a group of experts will monitor the study and stop it if it is clear one of the drugs is helping or hurting patients. After the study ends, we must share the results with the public. Every patient who comes to the emergency department at the University of Maryland Medical Center with a seizure will immediately be given the usual treatment, a benzodiazepine like Valium. If that does not stop the seizure, patients will be treated next with one of the study drugs. Patients will not be awake and will not be able to give consent to participate in the study, and there will not be time to get consent from a legally authorized representative. If the seizure does not stop, doctors will follow normal procedures to try to make it stop, including administering another medicine. Once the patient wakes up or the legally authorized representative is found, he or she will be asked for permission to continue to be followed in the study. If consent is obtained, the patient will be monitored by the study team until leaving the hospital. If a person does not want to be included in the study, he or she can ask for a bracelet that says ESETT declined, that must be worn at all times during the study period, about 4 years. The words ESETT declined can also be added to a patient's medical alert tag or system. Or call the study's principal investigator, Dr. Jennifer Hopp, at 410-328-6266 to discuss opting out of the study. The study is taking place at the University of Maryland Medical Center and several other hospitals in the United States. We want to hear what you think about the study before it is started. Do you think it is okay to do this study? The study team and the local research review board will consider your opinions before deciding if it's okay to do the study in our community. Questions, comments, or concerns about the study can be directed to the study's principal investigator, Dr. Jennifer Hopp, or the study coordinator, Virginia Ganley.